So, how do you know if your organs are doing this inside your pelvis? Stay tuned, and I'll share with you some signs and symptoms to recognize whether you might be dealing with prolapse or not. Hi, everybody. Lynn Schulte here with the Institute for Birth Healing, and today I want to talk to you about prolapsing of your pelvic organs. And it's such a huge topic, and what I really want to cover today is whether or not you might know if you have a prolapse or not. What are some of the symptoms, what are some of the signs, and how to best really evaluate if you do have a prolapse. So I'm going to do a screen share here. So here we have pictures of a cross-sectional view of our pelvis here, and this is your pubic bone in front here. This is your bladder, your uterus, and your bowel. This is normal arrangement in the pelvis, and this upper right picture here shows a bladder prolapse. This is when the bladder pooches out into the vaginal canal. This is the vaginal canal over here. And this picture here kind of just depicts a stage 3 bladder prolapse, where it's right at the opening of the vagina. If you were to spread your labia apart, the bladder's right there. This picture in the bottom left-hand corner shows a rectal prolapse. This is when the rectum pooches out and pushes into the vaginal canal. You can still see it's right there. And with this vaginal, or with a with a rectal prolapse, you may have some difficulty having stools, like evacuating stool from when you have a bowel movement. And one of the things that can help is if you were to actually insert your finger in vaginally and you push the stool back down towards your tailbone or down towards the ground. If you push it in this direction, that can help evacuate the stool. Sometimes it pooches too far in that it misses the outlet here and it can't figure out how to come out. So that is a rectocele. And then we have a uterine prolapse here. This is when the uterus just comes straight down the canal and comes right toward the entrance, and that's a uterine prolapse. So this is what I'm talking about today. I'm going to go ahead and stop sharing. And I want to just let you know that a lot of women come to me because they're wanting to know, do I have it or not? And I went to my doctor, and my doctor says no, and my midwife says maybe, and they get in all different kinds of confusing answers to their questions. And here's the problem. A lot of times practitioners are only checking you when you're laying down on your back. And if they're not assessing you in standing when gravity is, affecting the body, then they don't know for sure whether or not you have a prolapse. So many women that I've worked with have actually, when I check them and they're laying on their back, they don't look like they have a prolapse, or they don't, I can't feel like they have a prolapse. But then I stand them upright and it's like, oh yeah, yes, you do. So I've made it my, policy that I always check in standing no matter what, because I want to make sure when gravity affects the situation, that's the true picture. So if you're getting conflicting information from different practitioners, if nobody's checked you in standing, then they don't know for sure what's going on. Gravity changes the entire situation. So some of the other signs and symptoms that you are dealing with prolapsing is, I've already talked about one with the stool, like the stool just can't flow out. It kind of gets stuck, like you can't find its way. And just putting your finger in vaginally and pushing down can help get that stool, redirect the stool toward the anal opening, the sphincter. So that's for rectocele. For bladder or uterine prolapse, some of the signs that you might be dealing with something is if you feel like that tampon feeling that's falling halfway out, or if you tried to use a tampon and the tampon can't stay in all the way, or if you're using a Diva cup and the Diva cup, just it falls out, it's getting pushed out. Those are signs that you might be dealing with prolapse. Also, if your situation, if you have pelvic pressure like that tampon's falling halfway out, that's a sign that you might have prolapse, especially if that pressure gets worse towards the end of the day. Then that's a huge indicator that you're dealing with prolapse, because gravity is kicking in more. And you've been dealing with gravity all day, and those organs just find their way lower, lower, lower into your pelvis. There are so many things that are contributing to whether or not you get good support in these, in the pelvic region, we have to assess your feet. We have to look at your posture, how you're using your body, how you're lifting, how you're moving, how you're walking. All those contribute to whether or not you're either supporting your organs or you're not. A great resource for you to start with is to get Katie Bowman's Diastasis Recti book and start applying and doing those exercises and applying those principles. And that's the first step. But I always recommend that you also get some internal release work done. Those organs need to be able to move back up. And a lot of times I find there's restrictions in there not allowing them to come back up. So that is contributing to why the organs are falling out, is that they can't find their happy place back up into the pelvis. And so stay tuned for other videos as I piece this apart. I'll be offering other tidbits on how to deal with prolapse, but that book is a first good step, and getting some internal vaginal work in standing. That's the best. So, okay, good luck. And also one more thing, if you've had a baby and this prolapse happened from the childbirth, from the laboring process, the sooner you can come in and get some help and get some support, the better off you will be. The body's still in that birthing, laboring out position. And if we can close that up and get the organs back inside and get you from bearing down so much, that can all help heal this situation. So get help immediately after you have a baby if you're feeling that the organs are not in their proper place afterwards, okay? All right, good luck everybody, take care.